So welcome to the Law and Medicine quiz part of our podcast. Your first question is: Presidential Decree number 612 is known as A, the Insurance Code of the Philippines, B, Prevention and Control of Marine Pollution, C, Philippine Competition Act, or D, Authorization for PCSO for the Filipino.
I think I would go for D, the
D,
authorization
PCSO for
for
Filipinos
PCSO.
is the wrong answer. 612 is actually A, the insurance code of the Philippines. What an auspicious number for lazy people. I
Okay.
finally figured out Marvin's family almost,
Okay.
barely. Kevin Mark Lozano. So cute, no?
Mark Kevin.
Yes, I went on a date with him last night. It was so good. I was like back in Zobel with him. What's with
What?
that face? It is an agreement whereby one undertakes for a consideration to indemnify another against loss, damage, liability arising from an unknown or contingent even. Indemnify is to what? Compensate for harm or loss. It sounds so harmful, but it's actually to compensate. It is an agreement whereby one undertakes for a consideration to indemnify another against loss, which is it A, contract liability, B, contract of insurance, C, investment contract, or D, contract of sale?
I think contract liability
Okay, I think it's B, contract of insurance.
was the correct answer.
Oh, I'm right. Number three, the consent of the husband is blank for the validity of an insurance policy taken out by a married woman on her life or that of her children. A, necessary, B, not necessary, C, needed, or D, indispensable.
Not necessary.
Oh, what? The answer is B, not necessary. Oh, great
Yes.
answer.
Why aren't
um,
you writing the answer?
the married woman or the minor herein allowed to take out an insurance policy may exercise all the rights and privileges of an owner under a policy. The preceding section does not authorize an insurance for or against the drawing of any lottery or for or against any chance or ticket in a lottery drawing a prize. Which of these are correct? A, both statements are incorrect. B, both statements are correct. C, only statement 1 is correct. Or D, only statement 2 is correct.
Um, both statements are correct.
Letter B, I think the same. Yeah.
Ooh.
Oh, we're both right.
Yeah.
Oh, wait, no.
Oh wait, no.
I don't know the answer. I have to search it again.
What happened to your
Law
answer sheet?
exam. Eh di putang ina naman talaga, oh. Sobra naman to. Nasa na ba? Eto ata to. Letter B ang tamang sagot. Ito ay both statements are correct. Check again.
Yes.
Tama. Okay,
Yes.
number 5. Yes.
Go, go, go.
All kinds of insurance are subject to the provisions of A, the Insurance Code of the Philippines, B, Prevention and Control of Marine Pollution, C, Philippine Competition Act, or D, Authorization of Form PCSO for the Filipino.
Um,
Nice.
maybe a.
A. The answer is
What's your guess?
actually, well, A. It's A.
It's
Awesome.
a
Next, what are the characteristics of a partnership? A. Consensual, nominate, bilateral, communicative. B. Consensual, nominate, bilateral, commutative. C. Consensual, nominal, bilateral, communicative. Or D. Consensual, nominal, bilateral, commutative.
commutative.
Commute
Um, is it a typo? I would go for C, communicative,
with nominal. What does
nominal.
nominal mean for you?
What does nominal mean? What is
Nominal is
nominate? What is
actually
nominal?
existing in name only. So your marriage only exists in both your names.
Huh? Oh, by the way, I just got my passport with Marvin's name.
Oh, that's so cool, dude. What about your BPI next?
I don't have a BPI. I canceled it.
Right, right, right. It's so romantic. Um, the answer is A.
It's not.
A partnership must be consensual, nominate, as in having a special name or designation in law, bilateral, as in having two or more parties with reciprocal rights, and
Mm,
communicative,
communicative.
as in the undertaking of each partner is considered equivalent to all partners.
What is
What?
commutative?
What is this?
What does commutative mean?
Oh, I got it from another source. Sometimes these little bugs get in my computer.
Oh,
Yeah, so they tinker with a lot of things. Commutative, I guess. So I guess it would be B, not A, right? I think they made a typo here. Number
it could
two, the
easily be a
following
typo.
statements are provided for you. Statement one, parties must have legal capacity to enter into the contract is an essential feature of a partnership. Statement two, mutual contribution of money, property, or industry to a mutual fund is an essential feature of a partnership. A, only statement one is correct. B, only statement two is correct. C, both statements are correct. Or D, none of the statements are correct.
D, both are correct.
Oh, unfortunately, I remember the answer for this, and it's only statement one that's correct. You should not put all your money to a mutual fund.
Oh,
Yeah.
I'm gonna fail.
Number three, no, you will not. No, you will not, girl. Every person, partnership,
Thanks.
association, or corporation duly authorized to insurance businesses as business insurance to business as elsewhere provided in this code may be an A, insured, B, insured, C, mortgager, or D, insurer.
Insurer?
Ah, yes. Every person, partnership, association, or corporation duly authorized to insurance business, as elsewhere provided in this code, may be an insurer.
I know,
Very
right?
favorable for people who have insurance
But we're
vis-a-vis people who don't have insurance. Okay, number four. Anyone except a blank may be insured. A, public enemy. B, public friend. C, private enemy. Or D, public officials.
I think a public enemy.
Oh, yes, that's right.
Oh, Meg, yung bird.
Unless the policy otherwise provides, where a mortgager or property effects insurance in his own name, providing that the loss shall be payable to the mortgagee, or assigns a policy of insurance to a mortgagee, the insurance is deemed to be upon the interest of the blank.
The banker o the pula.
I will say it
The
again since I am cerebrally inept. Unless the policy otherwise provides, where a mortgager of property affects insurance in his own name, providing that the loss shall be payable to the mortgagee, or assigns a policy of insurance to a mortgagee, the insurance is deemed to be upon the interest of the
mortgager.
That is so
Ambot.
cute. That's correct. B, mortgager.
Ay!
Okay, we move on to internal medicine, nephrology and
What the?
urology, QID 37921.
Oh my God,
You are
that's so
seeing a
hard.
20-year-old man who complains of puffy eyes and swollen ankles for the past 2 months. He also states that his urine looks kind of frothy and foamy. Just a moment.
What is that?
My ear canals are tight because of the growth pills I've been taking. On exam, all of his vital signs are within normal limits, and the exam is unremarkable, including a fundoscopic. Except for mild bilateral edema, 2 plus in the bilateral feet to the ankle, he has never had any medical problems or surgeries. His laboratories reveal a normal serum creatinine, and urinalysis is significant for 4 plus protein without blood or bacteria. He undergoes a kidney biopsy, which is normal on light microscopy but shows diffuse podocyte effacement on electron microscopy. Immunofluorescence is negative, which is the best treatment for this patient. Yeah.
I would say it is
Tanga.
cyclosporine.
Why, hello there.
Hmm,
Cyclosporine is not correct. It is corticosteroids.
I haven't heard
He
that word
has
in
to
my whole
take
life.
more protein things. This patient most likely has minimal change disease. Minimal change disease is most common in very young children, but does not commonly occur in older children and young adults as well. Minimal change disease is a unique disease in that it lacks visible evidence of pathology on light microscopy alone. Characteristic findings on an electron microscopy exam include podocyte effacement, vacuolation, and growth of microvilli on the visceral epithelial cells.
That
Corticosteroids
sounds
are the
so
initial treatment of choice. A
that sounds so
typical
bad.
initial regimen is oral prednisone in a daily dosage of 1 milligram per kilogram of body weight for 8 to 16
Papasan.
weeks or until a week after remission is achieved, followed by an alternate day single dose, and then tapered if proteinuria disappears or falls to a very low level. Wonderful. Question 2, endocrinology and metabolism. QID
That's so crazy.
37910 as opposed to 37921.
Did you learn these things in health
A
science school?
25-year-old woman presents to your office for evaluation of fatigue and polyuria for the last 9 months. She also had anorexia and an unexplained weight loss of 12 pounds. She has had night sweats for a few months as well. Upon review of her labs from an annual exam around 9 months ago, she had mild hypercalcemia and all other tests were normal, including glucose. She has been playing outdoor tennis more regularly and was expecting to feel better with an increase in exercise. She does not have a history of nephrolithiasis, no fractures, no family history of hypercalcemia. She does not take Any medications? Physical exam, weight 125 pounds, height 5'2", blood pressure 102/74, heart rate 94 beats per minute. She has dry mucous membranes. Which medication would best address the cause for this patient's hypercalcemia? Poppy?
Uh,
Right here,
Zelendronic
baby.
acid.
Zolendronic acid for hypercalcemia? I believe it's prednisone. Oh, she's pregnant. She's carrying.
Really?
Yes, she is calcifying because of the stress that she's carrying. Vis-a-vis other things that she could be carrying, like microvilli. Prednisone. The patient has sarcoidosis, which is associated with hypercalcemia. Hypercalcemia occurs in 11% of patients with sarcoidosis, hypercalciuria in 40%, and renal calculi. What? In 11%. All right. Intrarenal calcium deposition can result in
Third
renal
na na.
failure.
Gulay.
Sarcoidal macrophages have 25 hydroxy vitamin D1 alpha. Hydroxylase, which converts 25 hydroxy vitamin D to the more active vitamin D metabolite. This patient's hypercalcemia was made worse with increased sun exposure and may have increased her risk for dehydration. The best initial initial treatment is prednisone, since
Oh,
corticoids decreases the conversion of 25 hydroxy vitamin D to 125 dihydroxy vitamin D.
I'm gonna be a bad doctor.
Yes, I also need something really important which I could not afford right now. And something I mentioned yesterday, I do need my DHA, girl. My brain is deteriorating as we speak. I've been taking it every day for the past 30 days, times two, 60 days. So the sudden not taking it is affecting my
I
brain.
literally have just $6.
DHA.
You wait
So
4 years my salary.
I am. So you just have to bear with my tongue tying.
It doesn't even sound
Sing?
different.
Did it not? Well,
No.
it does now because I've seen his dad's face, his brothers and brother-in-laws. His name is Brian.
Mm-hmm.
What does Brian do?
It's an IT,
Really?
I
He's into
think.
tech as well. So
Yeah,
he's gonna have a good time with JC.
maybe.
What's another name for HCV RNA?
Surface antigen.
Oh, no, it's not. It's actually a viral load. I have to keep passing this viral load every year. Because I have AIDS. You go get
And
AIDS,
you
girl.
don't.
What is an anti-U? It's
I have
something
claws and
you
you
get
don't.
after exposure to the U antigen through blood transfusion or pregnancy.
Uruguay. Naturally occurring antibody.
No, it's found only in black individuals. You're black. You're black. You have to be blackified to be cured, girl. Like done. Dunsey is over. It is done. A 21-year-old college student was admitted to the hospital in July with a fever of 40 degrees Celsius, dry cough, dyspnea, and prostration of increasing severity over the past 24 hours. He had been previously healthy and was spending his summer on Martha's Vineyard as a groundskeeper for a golf course. He was living in a beach house with some college friends with no pets in the house. He did not use alcohol or tobacco and had no history of recent travel. On admission, he had crackles over both lung fields but no other abnormalities on physical examination. Bilateral pneumonia was present on chest x-ray. WBC was 4,100 with a normal differential. Hemoglobin was 15 and platelets 150,000. His AST and ALT were 2 times normal. He said his co-worker at the golf course had been admitted with a similar illness the prior day to another hospital. Among the possible inhalation
Whoa.
exposures that must be considered in the management of this patient, which of these is the most likely? A. Ticks or small rodents ground up by the lawn mower. B. Cleaning out rodent nests from under the tool shed. C. Scraping pigeon droppings off the patio. D. Scrubbing the shower floor at the swimming pool. Or E. Spreading compost on the floors.
Um, maybe it could be from the birds.
And the birds, according to
Dropping
this, it
pigeon
is
droppings.
ticks and small
Pigs?
rodents
Oh,
ground
it's the
up by the
rodents.
lawn mower.
Bawa.
The geography should suggest tularemia is more likely than some of the other options,
Oh my God, that's so
especially
scary.
hantavirus pulmonary syndrome from rodent nests that would be more likely in the southwest. Tularemia is usually acquired from an infected small animal through cutaneous sorry inoculation of the animal's blood into a small cut from a tick bite. Oh, you've been watching him sleep. Or someone else is. However, machines that cut grass and brush can aerosol tissue or
Okay.
ticks. Oh, okay. That cut grass and brush can aerosol tissue what? Or ticks from infected animals can cause pulmonary tularemia. Oh, is
That's
it a
so
lung problem?
scary.
Marvin's lungs? Have you been smoking in your patio? Mm-mm-mm. Next case, a 49-year-old male third grade school teacher with HIV infection complains of fatigue. He was started 3 months ago on dolutegravir, tenofovir, and emtricitabine after presenting with CD4 count 75 cells per microliter and viral load 100,000. His hemoglobin was 13 grams per DL prior to therapy, but is now 6 grams per deciliter. Chemistries are unremarkable, including liver function tests, haptoglobin, and LDH. He has no evidence of blood loss and has negative stool tests for occult blood. He had a urinary tract infection last week and was started on ciprofloxacin. He also takes vitamin C. No one in his household has been ill, but some of the children in his class had been out last month with fever and facial rash. Which of the following interventions is most likely to be beneficial for the most likely cause of this anemia? A. Stop vitamin C. B. Initiate erythropoietin. C. Switch antiretroviral therapy from sorry, dolutegravir,
Gravir.
dolutegravir to efavirenz. D. Initiate corticosteroids. Or E. Initiate IVIG.
Initiate IVIG.
IVIG stands for intravenous
Invigorate.
immunoglobulin. We're gonna pump blood into this man.
Invigorating.
That is ridiculous. This patient with pure red blood aplasia with no clear evidence for hemolysis or gastrointestinal blood loss likely has a parvovirus B19 infection. Unlike the transient aplastic crisis seen in patients with increased erythropoiesis, immunosuppressed patients with parvo B19 infection develop chronic anemia. For diagnosis, PCR detection of viral DNA in blood is the best test. Bam! Bam, girl! Needs that blood in me.
So, what is your Christmas wish list?
My Christmas list.